In this video, I'd just like to talk a little bit about our antenatal care packages. Ideally, we like to see women from early on in their pregnancy. And we like to do a dating scan at around 6.5 weeks to show that there's an embryo, that it's the appropriate size, and that there's a heartbeat. If we can show you these things, then we can be very positive indeed that your pregnancy is very unlikely to miscarry and is likely to continue. Following this, we then like to do a harmony test at around 10.5 weeks, looking for fetal DNA in the mother's bloodstream. Again, this is a non-invasive test and gives us very good information. At 12 weeks, there's then a detailed ultrasound scan looking at the baby much more closely, as by then most of the organs will have formed in the baby and are easily identifiable. This allows us then to have an idea of the chromosome makeup of the baby, and also that the baby is phenotypically and genotypically normal. Then we like to see women around 16 weeks, because it's nice to be seen at that point and reassured that the pregnancy is continuing well, before there's another detailed scan at 20 weeks, checking all the anatomy in the baby for a last time. After this, we see people every 4 weeks until around 32 weeks, when again there's another scan to check the growth of the baby and the well-being of the baby, just to see whether or not we need to bring the delivery forward for some reason, and certainly to time the delivery as best we can. And then we see you 2 weekly until 36 weeks, and then every week thereafter. Blood tests and other scans and things might be arranged as appropriate, and of course we may err from this path if for any reason we think that things are more high risk and that we need to keep a closer eye on it. We also are acutely aware that many of our patients lead very busy lives. They maybe travel backwards and forwards quite a lot, and they have busy jobs. So it's not always possible to come exactly as planned, and we're very flexible about trying to make that work for all of us whilst maintaining safety for the baby. Obviously, also a lot of women only arrive in the country late on in their pregnancy, or choose to come to see us late on because they're abroad. Some women will transfer from the NHS late on in their pregnancy. We're very well versed at dealing with this kind of situation and have a number of packages that I hope you will find useful should you find yourself in that situation. If you look at the website again, you'll see there's a list of all the packages we offer and the prices to match. Please have a little look and see if there's something there that fits your situation, and we'll be happy to do our best to look after you the way you'd like to be.